Dr. Dickman, as you know, I reached out to you immediately after I read the piece that was published in the Journal of American Medical Association. That number floored me, nearly 64,000 pregnancies from rape. It's a stunning figure. When you were doing the research, and you were the primary lead on this particular study, you went and you looked at these numbers. What really stood out to you other than these outrageous numbers?
Well, thank you, Katie. And the research that my colleagues and I did was a confirmation of what we know about sexual violence and rape in the United States, which is that it's extraordinarily common, much more common than I think most people really appreciate, and that in states with abortion bans, there's really no meaningful access to care for survivors of sexual assault and rape who need medical services.
Dr. Dickman, talk about the actual journal, the Journal of the American Medical Association. Talk about how studies like yours that are published in that particular publication, how they're peer-reviewed, how they go through a stringent review process. Because there are some critics, right, that we've seen out there of your study that are saying, well, these are just estimates. These are just random numbers that were, put together from the researchers in this case to fit a particular narrative.
I wish these numbers were not so high, but we use the best available evidence from the Centers for Disease Control, the CDC, and they conduct excellent research on the levels of sexual violence and rape in this country. That's the starting point for the estimates that we provide for the number of girls and women who were raped in states with abortion bans, as well as the number who became pregnant as a result. Like every research study in this journal, our study was peer-reviewed and, of course, describes assumptions and limitations that are inherent to any research. Yet we think that this is the best available evidence right now, and of course, we look forward to doing more research and collaborating with others on trying to figure out the scope and scale of this obviously horrific public health problem.
And Dr. Dickman, you talk about how this is the best available research that can be done. That is in large part because of underreporting by subjects, by these young women and girls. The underreporting to law enforcement, talk about why there's this fallacy when you look at a state that has an abortion ban with an exception, and I put that in quotes. Why is it just such a reality in terms of being a fallacy that these exceptions actually could help when it comes to things like underreporting to law enforcement and access to safe and legal abortions?
Yes, we know that only a small fraction of survivors of rape and sexual assault actually report that crime to law enforcement. There's so many reasons for that, but fundamentally what it means is that it's virtually impossible for survivors to obtain abortion care, or honestly, other medical services too. They may feel distrustful of law enforcement. They may be in a relationship with an abuser who has threatened them that they can't, travel safely even within their own, their own city. So there are many reasons why survivors choose not to report, and that doesn't mean that they don't deserve medical care, including abortion.
And Dr. Dickman, there is a reason why I use the honorific title of doctor. You are a physician. You may also do research, but you used to practice medicine in the state of Texas. The one that I noted at the beginning of your interview was at the very top of those states that have rape pregnancies that have occurred as a result of very draconian abortion bans. Talk about why you moved out of Texas to be able to continue to do your work.
Well, Katie, I worked in San Antonio in South Texas for several years as an abortion provider and a primary care physician. I moved in 2022 with my family because I spent years and years training to be a physician, and abortion care was a key part of that. And I wanted to keep doing that work. And unfortunately, Texas had made it very clear that the state had already banned abortions past 6 weeks into the pregnancy and was on the cusp of banning them outright. So I moved to Montana, and Montana fortunately has much stronger protections for women and pregnant people. So that's where I landed.
And Dr. Jipping, before I have to let you go, this study that has been published is only just a window of time since Roe was overturned in 2022. Is there an intent on your part and your colleagues to be able to continue to further the study to see the impact on women and young girls when they are raped and they have no access to safe and legal abortions?
I wish research like this wasn't necessary. I wish that sexual violence was not so common, and that survivors were able to access medical care that they need. We know that survivors are fearful of even seeking out abortion care, and that's for so many reasons, fearful of abusers, and knowing that they have no access to abortion care in states like Texas. So, of course, I hope that research like this helps shed light on that and results in a reconsideration of abortion bans, which have caused so much harm for survivors of sexual violence and so many other people in the U.S.